Hi, sports pharmacist. So for this discussion, I wanted to hear about what kind of advanced training you have completed as you've begun your practice in sports pharmacy. Have you received any certifications? Have you found any great online programs, or are you primarily self-trained? I've been in anti-doping for 15 years, and most of that has been self-training. I keep up with the World Anti-Doping Agency prohibited list and the code. And I have been working in anti-doping that whole time. I recently completed the International Olympic Committee's Drugs in Sport course, and I would highly recommend that. It's a good introduction. If you're new to the topic of sports pharmacy, it's a good introduction to the prohibited list, and it gives you some insight into working as a pharmacist at major events. And it also goes a little bit into the therapeutics of conditions that are common among athletes and the use of prohibited substances and therapeutic use exemptions. So it's well worth taking if you're new to the concept of sports pharmacy. And I would definitely recommend you do it before working with athletes if you're trying to promote your services as a pharmacist to athletes. And I know not all of us work with individual patients. Not all of us provide clinical services. There's lots of other areas of sports pharmacy that pharmacists participate in. But today I just wanted to talk about that additional education, those additional programs that are out there. And if anybody knows of any kind of comparison chart, I am hoping that someone's going to say, yes, I have done the comparison chart of all of those different categories of the professional athletes and what is banned for them and the NCAA banned substances list, and compared that to the World Anti-Doping Agency and wrote out the nuances for UFC. So if somebody has that, I would love to see that. And if not, maybe we can work on collaborating to create something like that. And then back to the different education that's available. I know that the World Anti-Doping Agency also provides the adult platform, and I did that originally when it came out. I felt that it was worthwhile, and they recently updated it and categorized it into the different sections. So now there's a healthcare provider section, so I'm going to redo that. And then also the US Anti-Doping Agency they currently offer a continuing education program for healthcare providers, and that's being updated as well, and it will probably be able to offer a certificate. So I would highly recommend that as well through the US Anti-Doping Agency. You can find that on their website under the resources, but I will put links to all of those educational programs that I know below. And as I said, please leave your comments about what kind of training you have received as a sports pharmacist and what have you done to further your self-education. So I know that some have worked in doping control. I would be really interested to hear what your experience is in that. And for those of you in the pharmaceutical or research categories, I would definitely be interested to hear what type of research you're doing with athletes and how pharmacists can impact athletes in any way. Thank you very much.